There are multiple strategies ongoing. There are maintenance and consolidation strategies. There's maintenance with immunomodulatory drugs and even cell mods, certainly in clinical trials. There are consolidative strategies, particularly with bispecifics. Generally same or different target, though more different target approaches. A very nice consolidation study was presented at IMS last month by Adam Cohen, where cevostamab was utilized as consolidation post-BCMA CAR-T with ide-cel and cilta-cel that has shown promising results with early follow-up. So certainly beyond consolidation, maintenance, debulking strategies such as bridging to debulk the disease, but also hopefully alter or improve the immune microenvironment are also some important considerations to enhance efficacy of CAR T-cell products for multiple myeloma.